Hello everyone, I'm Dr. Payal Shah, Consultant Endocrinologist at EPIC Hospital. Today we are going to discuss about thyroid disorders and their management. So what is a thyroid gland? Thyroid gland is a normal butterfly-shaped gland in the neck region of your body. It is a normal gland which produces T3 and T4 hormones in your body. They are produced in everyone. If there is a disturbance in the levels of these T3 and T4 hormones, then you have thyroid disorders. Basically, these T3 and T4 levels are controlled by another hormone called TSH, that is the thyroid stimulating hormone, which is produced from your pituitary gland in the brain. So, the disturbances are first reflected in your TSH levels. There are various kinds of thyroid disorders. Let's discuss about the most common thing, which is hypothyroidism. That is when your body is not producing enough amount of thyroid hormones, that is T3 and T4. So how do you know that you have hypothyroidism? Some of the most common symptoms are weight gain, facial puffiness, feeling very tired or lethargic, constipation, hair fall, excessive dryness of skin, irregular periods in females. These are some of the very common symptoms of hypothyroidism. So what should you do when you have any of these symptoms? Get yourself tested for thyroid levels, which should include your TSH, T3 and T4 levels. How does the doctor diagnose that it is hypothyroidism? When your TSH levels are above the normal range and your T3 and T4 levels are lower than the normal range, then it is called as hypothyroidism. And how will your doctor manage your hypothyroidism? So you will be generally started on a thyroid hormone supplement therapy, which is thyroxine, which is natural hormone which is produced in your body. And there are some important things that you should consider when you are taking the tablet. Like the tablet should be taken early in the morning on an empty stomach. And you should keep a gap of at least 30 minutes after taking the tablet when you take your tea, coffee or breakfast. So next we will discuss about the next other thyroid problem, that is hyperthyroidism. What is hyperthyroidism? Exactly opposite to hypothyroidism, when your body is producing excessive amount of thyroid hormone, that is T3 and T4, that is called as hyperthyroidism. There are multiple forms of hyperthyroidism which will be diagnosed by your doctor. But how do you know if you need to be tested? So some of the most common symptoms for hyperthyroidism are weight loss, increased frequency of your bowel movements, thinning of your hair and hair fall. You can have tremors or shaking of your body, palpitations, and irregular periods in females. These are some of the most common symptoms of hyperthyroidism. You should get yourself tested if you have any of these symptoms. With the same reports need to be done initially, that is T3, T4 and TSH levels. The further testing can be advised by the doctor. In hyperthyroidism, the TSH levels are on the lower side than your normal range and the T3 and T4 levels are higher. So how is that treated? There are various options depending on the cause of your hyperthyroidism. It may be your doctor may suggest you a medication or radioactive iodine therapy or surgery, depending on the nature of your problem. So most of the symptoms that we discussed are generally mild and ignored by most of us. So get your health checkup done. Here at EPIC, we have a multidisciplinary team approach to manage your thyroid disorders. Thank you.